Hello everyone. Today's interesting topic is preoperative evaluation in patients who are going for operative procedure like cochlear implant. See, in these patients we have to do medical evaluation so that to know whether the patient is fit for surgery or not. Point number 1. Even if they are fit for surgery, following the cochlear implant, will they benefit from the cochlear implant or not? Otherwise, if they are unfit for surgery or they won't benefit from cochlear implant, then there is no need of doing such surgery for these patients. Hence, preoperative evaluation becomes important. So the following are the point wise I have described. There are 9 points here. In detail I will tell you. The first point is medical history. A complete medical history of the patient is essential to know whether the patient is fit for surgery or not. If they have many medical associated conditions like chronic hypertension, diabetes, epilepsy, they will be taking more medications for that. Or they have any chronic diseases like rheumatoid arthritis, tuberculosis. So all this we should know their medical history. Second thing is their physical examination. So why physical examination becomes important? Even if the patient has got a medical history positive, but physical examination is, if the patient is fit for surgery, then anesthetist will give opinion towards a cochlear implant. If the patient is not fit based on the physical examination because of the other organ damages, then the anesthetist will tell the patient is not fit for surgery. If the surgery is done, maybe the surgery is successful, but we may have to lose the patient. Hence, physical examination of the patient, especially the cardiovascular system, the respiratory system, the nervous system, and perabdominal examination becomes important. Later, the detailed evaluation of the concerned patient, that's a medical evaluation. That is, if the person has got hypertension, we have to evaluate for the blood pressure, the ECG for the heart, and echocardiogram, to know the interior of the heart. Similarly, the respiratory system, we can do pulmonary function test, the spirometry, to know the various volumes of the lung. So it goes on. So based on what findings we get on physical examinations, similar medical evaluation may be required based on investigation, by doing suitable investigation. And the fourth point is audiological examination. So whether this patient who is undergoing this cochlear implant will benefit out of the cochlear implant or not, we'll come to know by audiological examination, starting from a simple tuning fork test like Rinne's and Weber's test to confirm the person has got sensory neural hearing loss. Those patients who are sensory neural hearing loss, they will go for cochlear implant, not with conductive hearing loss. Conductive hearing loss, there is some block in the external auditory canal or the tympanic membrane, perforation, or the ossicular chain rupture. We have to treat the same. Only if the sensory neural hearing loss patient will benefit from cochlear implant. Moving on to the radiological examination, computerized tomography scan. It is nothing but axial X-rays to know the outline of the temporal bone. MRI scan, magnetic resonance imaging. This is another scan where the soft tissues are visible clearly, especially the middle ear cavity, the eustachian tube, the fluid within the inner ear, that is the endolymph and perilymph, will be visible very clearly. So whether the architecture, anatomical and physiological architecture of the inner ear, middle ear cavity, eustachian tube is normal or not, is there is any tumor over there. To know that, we'll do MRI scan. So all these are done to evaluate the cochlea and the auditory nerve, so that if the cochlea and the auditory nerve are in the same position or they are displaced. When we do all these things and the patient is fit for surgery, but if psychologically, if the patient mentally, if they are not sound enough, even after the cochlear implant, they will not able to communicate with you, or the speech won't be normal because they are psychologically affected or mentally affected. Hence, The psychological evaluation by doing various tests, psychological tests, is important in the preoperative period to get a better outcome. Then speech evaluation. Imagine you have done the surgery for the ear, cochlear implant, but the speech of the patient, the speech area, broca's motor speech area itself is damaged, or the vagus nerve is some damage is there, or larynx some problem is there. So despite of doing a cochlear implant, you may not expect a better outcome because the patient will not be able to communicate. He may be able to hear you, but how do you know he is hearing you? He has to respond, right? That is by speech. If speech itself is defective, either in the brain or in the nerve or in the larynx, then that person won't be suitable for cochlear implant. Last but not the least, we have to enroll this patient for oral education program, in which they have a rehabilitation. They will communicate with their guides and they will have a better outcome. So we should enroll this patient in the oral education program. To summarize, the preoperative evaluation of a patient who is going to undergo cochlear implant is a complete medical history, a complete physical examination to rule out any defects which can affect the implant or may prevent the outcome. Then medical evaluation of the patient, audiological examination, CT scan and MRI to know whether the cochlea and the auditory nerve is intact or not. Then psychological test to know the mentality of the patient or the psychology of the patient. Speech evaluation to know whether the broca's motor speech area, the vagus nerve, the brain stem, the larynx is intact to get a better outcome. And finally, rehabilitation by enrollment of patient in oral education program. Thank you for watching and learning from Logic Medico.